Hello and welcome to Space Technologies in Public Health Management. During this webinar, I wish to share some of the space technologies that are actively in use in public health management practices. Before we talk about space technologies that are applicable, we need to look at the climate change phenomena, which is rising and posing growing health risks due to the severity and the changes in the environment. Earth observing technologies and data are crucial for planning comprehensive public health response at micro and macro levels. On the other hand, over the 50 years, remote sensing and geospatial technologies have been implemented to examine environmental factors in airborne, vector-borne, soil-borne, and waterborne diseases. Health-related behavior is contextual. It varies across geographic settings. Health facilities or supply and health consumers or demand interact with each other across geopolitical borders, and measures of healthcare accessibility needs to capture this phenomenon. When we look at disease rates in areas of small population groups, these are often unreliable. And one effective way to mitigate this problem is to construct a large, homogeneous, and comparable area unit. So defining a scientific geographic unit for healthcare market is critical for practitioners and policymakers to evaluate and deliver healthcare. So GIS or Geographic Information Systems enable defining this, that is, primary care service areas or hospital service areas or cancer care, emergency, and so on, automatically, efficiently, and optimally. In the basic form, GIS answers the where question. So where do people live? Where do diseases originate? Where is the source of pollution? And so on. So GIS can provide answers to other questions related to public health because the same maps that are created via GIS can help to show patterns between disease starting points, risk factors, and sources of pollution. There are two aspects that underpin GIS applications, that is incidence, which examines the number of new cases of a disease or a health issue over a specific time period, and prevalence, which is the incidence of existing cases of a disease over a specific period of time. So for example, chronic diseases. A disease that has a fast death rate will have a higher incidence than a prevalence in a community, and GIS can allow public health officials to see the distribution of deadly diseases and possibly find a source. Everyone is aware of the Johns Hopkins dashboards, which were created during COVID pandemic, which is also represented here. Earth observation epidemiology or teleepidemiology is a term used in public health. It is about using space technology with remote sensing in epidemiology. It is a useful tool that is used by clinicians and stakeholders for zoonotic infections. Teleepidemiology helped map out the spread of Ebola among animals and can also be used for risk mapping, communication, and identifying vulnerable populations. Geographic information science technology can improve the understanding and control of COVID-19 or other pandemics through surveillance, data sharing, digital contact tracing, investigation of risk factors, and infectious disease forecasting. When we look at the bodies that are involved in public health, to start with, the United Nations Conference on the Exploration of Peaceful Uses of Outer Space Technologies, which was held in 1999, had made a commitment to use space technology to help control infectious diseases. Space technologies are already assisting several aspects of public health and global health, including monitoring the environment and climate change and assisting in disaster relief. Space technologies also helped tackle the Ebola outbreak by using satellite imagery to plot disease transmission and plan relief missions, as well as by developing diagnostic labs used to test medications against Ebola. Space assets are now supporting the pandemic efforts, but have the potential to serve as an even greater role in enhancing the monitoring and mitigation of COVID-19 and in the preparedness and prevention of future pandemics. Potential areas in this include teleepidemiology, virtual care, telehealth, space spin-offs, supporting One Health approaches, and mental health preparedness. Space technologies has been in the forefront in the development of telemedicine to provide care to and ongoing monitoring of astronauts. Hence, satellite-based communication can also enhance telemedicine and expand healthcare to rural and remote areas. Australia has been in the forefront in deploying telehealth for servicing remote regions for over a decade that accelerated during the pandemic in 2020. The implementation of My eHealth records and the integration of varied sources, including GP, pharmacy, hospitals, and doctors, have been supported by geospatial technologies, as the contextual geography is equally important in health as well-being. Space spin-offs, on the other hand, involve making use of the technology on Earth that was originally developed for space, or by space agencies, and these are increasingly serving as an important part for public health. The space sector has developed specialized portable clinical devices, for example, that offer continuous real-time monitoring. For example, the BioMonitor, which was developed for the Canadian Space Agency to store and forward physiological data from unobtrusive body-worn sensors. This technology offers around-the-clock monitoring of heart rate, breathing, blood pressure, temperature, ECG, physical activity, blood oxygen levels, which are very valuable parameters to monitor in patients with active COVID-19 or long COVID. Such devices can be used to monitor health of healthcare personnel working throughout the pandemic or in aged care facilities. Another area is remote sensing technology, with 3/4 of the emerging infectious diseases are of zoonotic origin. Understanding the dynamics of vector and disease spread in human animal populations can only be accomplished by a One Health approach. So remote sensing data provides real-time information about dynamic processes of the surrounding ecosystem or air pollution trends, as well as keeping track and forecast vector-borne disease outbreaks. During the pandemic, NASA had contributed to research expertise and solicitation for the use of satellite data. Moreover, the group of Earth observations and the UN Office of Outer Space Affairs coordinated and connected global scientific networks working on integrating satellite data with ground-based public health surveillance records. UNOSA helps countries access space science and applications and integrated technologies, tools in national policies and practices via its programs in space and global health. The pandemic's increasing death toll, loss of loved ones, social distancing restrictions, and limitations to healthcare has had an impact seriously on mental health in every country. The space sector has considerable experience managing astronaut self-isolation and confinement to small spaces for long periods. These can contribute substantially to global dialogue on managing stresses, self-isolation during pandemic, and the use of technologies. Geospatial technology in the form of GIS enables spatial representation for public health planning and decision-making. So some of the Global health and medical applications of GIS are finding disease clusters and their causes, improving deployment of emergency services, determining if an area is being served adequately by health services. So many countries currently lack the benefits of geographic information systems to strengthen their health practices. So by connecting maps, apps, data, and people, the WHO, or World Health Organization's GIS Center, is supporting countries and partners to make informed public health decisions faster and to extend the reach of geospatial information across the organization. So geospatial data and techniques are also an effective tool to monitor progress and provide a strong basis for policy making to achieve sustainable development goals. So some of these services from the World Health Organization includes a software hub or GIS software hub, which hosts proprietary and open source software for use by countries, partners, and staff, satellite imagery support to reach many of the hardest to reach populations live in rural areas lacking detailed maps, which challenges health worker outreach. In this case, the imagery becomes a critical tool, and the Space Charter provides WHO with unique access to satellite imagery, and the WHO supports the processing and delivery of this imagery to countries. Another service area is mobile field data collection tools, which collect location data and improve data quality through rules and semantic integrity. Global Health Facilities database for measuring the availability and the physical access to health services is a prerequisite to understand the performance of health systems and their ability to deliver impact. An up-to-date geospatial database can maximize the strategic and accurate location of health facilities, their accessibility to population needs, and a supply chain of essential services and medicines. Another service area is geospatial datasets, where population datasets in relation to boundaries, geographic boundaries, and health facilities are essential for analytics. For example, this data helps us understand who is living where, various density of population, the number of people in various age groups, urban rural settings, economic stratification, other social demographic characteristics. So this service supports countries and partners in collating a baseline population. There is also volunteered geoinformation that is collected by users roaming the surface of the Earth. Often unnoticed, this contribution consists of content in various geographic locations around the world, and mapathons, which are crowdsourced activities to identify built-up structures to support public health responses, are also offered. Apart from these, the World Health Organization has training and capacity building in GIS and remote sensing to strengthen country and partner capacity. This enables efficient data collection using GIS apps, storing, management, analysis, reporting, and the use of geospatial data. Coming locally, Australian Institute of Health and Welfare has 36 dynamic dashboards showing the distribution of the impact of type 2 diabetes, cardiovascular, and chronic kidney diseases. Users can explore disease prevalence, hospitalization, and death rates alongside profiles of health and selected population characteristics at each geography level. In the latest Australian First project, the Australian Institute of Health and Welfare, along with ESRI, has created a series of interactive digital maps that improved access to geographic data across the spectrum of suicide behaviors, allowing users to better understand the distribution of population and community level risks. This application of GIS technology enables people to access and visualize critical data relating to suicide and self-harm deaths and hospitalizations, alongside other data monitoring, ambulance attendance, and coronial registers. The project offers all Australians a baseline understanding of geo and demographic risk factors, giving real-world context to prevention strategy by the government. It ensures vital information is available for communities to make data-driven service delivery and implement timely and effective interventions. It is an important framework or the technology solution for other health agencies to share crucial information with the public. For the first time, Australians have an access to the national connected picture of critical data on suicide and self-harm, which will serve as a best practice approach for other areas of public health systems. Bringing it all together, Esri Australia partnered with the University of Canberra to create a geospatial indicator framework, providing a health landscape for the nation to influence public health policy. Using GIS and geospatial modeling, it efficiently visualizes how environmental factors, lifestyle factors, and other risk factors, including chronic diseases, an evidence-based clear picture is provided to policymakers in public health. This breakthrough project is the first of its kind in public health that integrates latest technologies and real-time streaming from space to life on Earth. Thank you for your participation and attendance to my webinar. If you have any questions and require a reference list, please feel free to email me. Thank you.